Hi everyone, welcome back to my channel or welcome to my channel if this is your first video. My name is Ruta and I'm a new mom, and I started this channel to share my experiences as a new mom and talking about everything related to pregnancy, motherhood, etc. So just a disclaimer, I'm not a pediatrician or gynecologist or any medical expert to have certain opinions about certain things, but I'm totally talking about my own experiences as a new mom. And with that, I want to let you know what is the topic for today. So this is the third part in my series that I started a while ago called maternity or pregnancy myths. And today I want to talk about myths regarding first breastfeed. So when in a nutshell, I ended up having a C-section birth, and because it's a major abdominal surgery, I was advised, like everyone, to lie down and not sit at least for a day, like 24 hours. So you can imagine it is very difficult for me to take the baby and try to feed the baby or anything like that. And I was also told that, especially during C-section, maybe I might not even get a lot of milk. So this exact myth I want to talk about. Basically, there is this very widespread belief that your body needs to produce milk in order to feed the baby, in order to baby to be able to feed. It's actually other way around. It's the baby who triggers the milk supply. Now let me explain what actually happens. So once you have given birth, once the placenta leaves the body, either when it is vaginal birth, it is pushed out of the body and that's how it leaves. If it is a C-section birth, doctors will take it out of the body and that's how it. So in both cases, it just leaves the body immediately after the birth of the baby. Once the placenta has left or removed, basically your brain will get a signal that now the baby is out of the mother's body and now it's time for producing the milk. Lot of times, or most of the times, it's already there in the form of colostrum, which is like very thick, and it's called liquid gold for right reasons. It's very thick, it has a lot of antibodies, it has a lot of good properties, it has a lot of protein, and baby needs it immediately. So the recommendation is, and thankfully I had read about it before giving birth, only during my pregnancy I had read about feeding and everything. So I had read that as early as possible you should ask for skin to skin contact. So before the surgery started, I had asked that once the baby is born, can you put the baby on my chest, and the doctors agreed and they gave the baby to me for like few seconds, and then once they were done cleaning and weighing and all these formalities are done, they again gave the baby to me, but this time it was not exactly skin to skin. It was like the baby was wrapped, but the baby was on my chest. But yeah, I think in retrospect, I should have asked for complete skin to skin, asking everyone else to just leave the room and just let me be with my baby alone. I did what I could. Then they started feeding the baby little bit of formula, stating that they, as in the nurses, stating that the baby will need some food, and since you are not going to be able to feed for at least 2 days, we will start with the formula. I was like, okay, I was not sure, but since I was not allowed to sit, so I was like, fine. But then I don't know, it is maternal instinct or what, but so I gave birth around 4:50 p.m. and the next morning around 8 a.m. or whatever, I had this strong urge that even though I'm not allowed to sit, the bed can be put in a recline mode and I can still try. Try taking the baby and just try to feed and just let the baby try latching at least. Whatever, even if she gets one drop, it's fine. Even if she gets nothing, it's fine. But I just want the latching to start. So I literally cried, and it's not like I was made to cry, but I was really emotional when I demanded that I want my baby with me, and then they gave, and they were like, you know what, there is catheter attached, and blah blah blah, and you cannot sit with that, and this and that, and I was like, okay, but I really need to work around. So they did let me take the baby. Um, After they removed the catheter, there was I gave, so they gave the baby to me. She did try to latch. She did little bit of sucking. I don't know whatever she did, and then she was sleeping all the time. Basically, she would wake up for some time and then sleep. So I was not sure if she got anything, but when she woke up, they said that, do you want to try giving her formula again? I said, okay, try. If she is hungry, if she is taking it, I'm not sure whether I was able to. So we can do it alternately, like alternate formula, alternate feeding. But then what happened was she rejected formula completely, and then they said that no, I think she is getting milk from you, so that's why she is not having formula. So I was like, very very happy. I think for the first time after giving birth to her, this was the second happiest moment in my life. That yeah, I'm so amazing that I'm able to feed her right away. And it's not like it's all myth basically that your body cannot produce milk immediately. Whatever little your body can produce, it's enough for that baby. I would say that. And I'm not saying that whoever has experienced difficulty in feeding, it's wrong, but what I want to say is basically, don't necessarily listen to anyone when they tell you that no, it's impossible. At least try. My point is, at least try, and at least see if the baby latches. If there are difficulty latching, if the technique is not right, then also it is possible that baby is not able to feed, but then the baby will keep crying. That's very very important. It's that basically after maybe latches and has little bit of milk, the baby becomes really calm, doesn't cry, doesn't become fussy and everything. So that's your cue that you did your job, and baby also did her or his job. So yeah, it's important that you try at least, and not listen to any of these statistics or whatever it is. Just don't, and just believe in yourself. Watch few videos on latching techniques, what you can do to help your baby. There are these techniques. Get help from lactation consultant. In my case, the lactation consultant arrived at day 3. So when she arrived, I was like, I already started feeding her, and she was like, yeah, good job. But she really gave me few helpful tips for feeding the baby correctly, and things that can make my job and baby's job easier. So that was helpful. But yeah, so get help from lactation consultant. Watch few videos from credible sources. If I can, I will list the sources or videos I watched for learning the latching technique. But yeah, it is important, even if the baby doesn't latch, it is important that you establish skin to skin contact, because skin to skin, when it happens, basically baby's mouth is around your body, around your chest, around the breast area. Baby being there releases oxytocin in mother's body, and oxytocin is called love hormone. Oxytocin is also called precursor to prolactin, and prolactin is the hormone that triggers milk production. So first your baby touches you, then it triggers oxytocin, then it triggers prolactin, then it triggers mammary glands to produce milk, and then when the baby is latching effectively, it goes into baby's mouth. So yeah, many factors play a role here, but then it's important to keep trying and keep doing skin to skin. If nothing else, it is going to help your baby regulate her body temperature, even relax her, that she's in a good state, She doesn't need to be scared of anything, and it will help her sleep. It will help her feel restful. It will reduce the cortisol levels of the baby. So even if you are not able to feed, you can achieve all these things, and I'm sure eventually everybody is able to produce, given good, given practice, and given they keep trying improving their technique. So I hope this helps whoever is watching my video. I hope this helps you if you are in that stage where you are almost due, or you are in the stage where you are not able to produce milk or something. It's a very difficult time, it's a very difficult phase, but I hope this video helps you. And from my end, I will try to list few videos which explain good technique. So yeah, I think all the best, and I will end my video here. Thank you so much.